This last little part has to do with burns, but I wanted to take our time with it and make sure you have a good understanding of soft tissue injuries that are caused by burns. Burns can be caused by electrical injuries, in which case we look for an entrance and an exit. They can be caused by chemicals, most of the time they're acids or alkalis or powders that get activated with the sweat from our body, but the most common is going to be thermal burns. So we think of thermal burns burning through the layers of the skin. The skin serves as a barrier that keeps outside substances from entering the body. It also prevents loss of body fluid, so when that skin is damaged, these can no longer function as you would expect. We look at superficial burns, so we think, oh, everybody gets a sunburn, that's just part of life or whatever. But you can see any place that you would blanch it. You press your thumb in on a place that's red, and when you let go, it blanches white. That's what we call superficial or a first-degree burn. It is painful, and as it starts to heal, it can cause some pain. It also causes fluid loss. So we have to think about the degree, the extent, how much of the body has been burned, and even a first-degree burn can be significant if it covers the whole body. Partial thickness burns that are deeper, that are not superficial, we call second-degree burns. So they damage the epidermis and the dermis, just not the deeper layers of the skin. The biggest thing that you see is blistering, and you can see the blistering on this patient here. Fluid loss can be moderate to severe. They start shifting fluid into those blisters, which we don't break because it's a seal, it's a solid formation. When we break that, we invite more infection in. The biggest thing that somebody that has burns like this are going to complain of is pain. They're going to have severe pain. If you've ever even had like a little burn from the oven, or a burn from an iron, or a burn from a flame, and how many days that bothered you, most of the time second-degree burns will heal themselves within 2 to 3 weeks. Whereas full thickness burns, it goes through all the layers of the skin, the epidermis, the dermis, subcutaneous tissue, all the way into the fascia of the muscles. And in the dermal layer, the middle layer, lies the hair follicles and the sweat glands and circulation and nerve endings. And so people that have third-degree full-thickness burns will not complain of pain where they have these burns because those nerve endings have been destroyed. But almost always, a burn has a graduation. So maybe they have a third-degree burn on their upper arm, and toward the shoulder and the elbow it's a second-degree burn, and then towards the wrist and the chest it's a first-degree burn. So they're still going to have pain where they have first and second-degree burns. Patients that have significant burns lose a lot of fluids in that third spacing, and they're very susceptible to shock and infection. We look at the extent of burns, the body surface area affected by burns, as a rule of 9. And it's just a method for determining percentage of the body that has been burned. So in the adult, the head and the arms equal 9%, whole thing. But the front and back of the trunk, as well as each leg, is 18%. It's modified for children. So looking at this picture on the right, you can see that if this person had a flash burn to the chest, now chest and abdomen are 18, but chest only is 9. And the anterior arms, oh wait, this is getting confusing, isn't it? So the whole arm is 9, but the anterior arm would be 9.5. I said arms. So 4.5 plus 4.5 equals 9, and then 9 for the chest. So if a splash burn to the chest and anterior arms would only be 18%. Whereas if you look at the infant, the head is twice the size in proportion to the rest of the body. The infant's head accounts for 18%. And where does that percentage come from? It comes from the legs. Instead of being 18% for the entire leg, it's 13.5%. So kind of be familiar with these rules of 9s. When you add them all up, it comes to 99, and then 1% for the genitalia. Especially for the adult, be familiar with those. If you ever forget and you're like, God, is The upper arm 9, is that the whole thing? Well, maybe the leg's 9 too, or maybe the arm's 18. Just lay your arm beside your leg and say, are these the same size? And you would answer yourself and say, no, my leg is twice the size of my arm. So the entire arm is 9, the entire leg is 18. So if we had somebody that dropped some acid or something like that down the front of their pants and they had burns on their anterior legs, each anterior leg would be 9% times 2. One for each leg, 18%. So just something to kind of think about. Be familiar with the rule of 9s. Thermal burns are the most common kind of burn injury caused by heat. So it can be like open flame, it can be hot water, it can be a metal object that's heated. Thermal burn. And the first thing we want to do is cool the burn. Put out the fire. You know, if you've ever burned your hand, it's on fire, so cool that burn. Then we're going to loosely cover it with dry, sterile dressing. If it's a large burn, then a burn sheet. Don't break the blisters, and patients with large burns have to be treated for shock, fluid replacement, and transported to a hospital, hopefully one that has burn care. Now there's 5 parts of the body that if any part of the 5 that I'm going to talk about have a burn, we call it a critical burn, and one of them is an inhalation burn or a respiratory burn. So if they inhaled really hot air, and of the two, moist air versus dry air, moist air causes the most burn. You think about it, you get that microwave popcorn out and it smells so good, and you open the bag and you place your face over it and take a nice whiff of that buttery popcorn. And all that steam comes up. That's moist heat. So people that do that, you know, that's 600 degrees Fahrenheit when you lean over that bag of popcorn. People that do that risk the chance of having a respiratory burn. Now, what do all burns do? Burns of the arm, burns of the legs, burns of the feet, they all swell. So if somebody has a burn, an inhalation burn, it's going to start to swell. And we look for signs and symptoms of inhalation burns or respiratory burns based on burns to the face, singed nose hairs or singed hair on the top of the head that, you know, you can see how hot the face got. Maybe some soot around the mouth and nose to show that they were actually breathing in combustibles. Difficulty breathing, pain while breathing, or even loss of consciousness as a result of the fire. So these breathing problems can develop either very rapidly or very slowly. The thing is, once that area swells and closes off, it's going to be very hard to breathe for these patients, so we want to get prompt transport available as soon as possible. Chemical burns. So we had talked about thermal burns, and these are chemical burns caused by any kind of chemicals. The longer the chemical remains in contact with the skin, more damage it does. Therefore, as soon as we can, if we identify somebody that has a chemical burn, it could be acid, alkali, petroleum product, a dry chemical, anything. Get as much of the chemical off as possible. And here's something that you have to do. It's almost like a hazardous material. If you think of it like that, you think of decontaminating. So depending on where the chemical burn is, meaning like if they poured a little bit of hydrofluoric acid or sulfuric acid on the arm, we have an isolated injury. We can, irrigate that for 20 minutes. We can get it off. But if they have a splash burn where they have it on their clothes, you want to rapidly take off all of their clothes. And here's a good rule of thumb. Anything they weren't born with comes off. So if they have contact lenses and they have a burn near the face, you don't want to take any chances and have a little bit of that chemical behind the contact lens, and it's slowly, the more time that's there, causing more injury. Remove those contacts, irrigate the eyes. Anything that person wasn't born with comes off. If it's a dry chemical, dry chemicals are activated with water, so make sure you brush off as much dry chemical as you can before you irrigate it. Your book says 10 minutes, so I kept it in here for 10 minutes, but ideally 15 to 20 minutes is better. Make sure you contain whatever that is. And if you're flushing, especially like the eyes or something, make sure you don't splash chemical into an uninjured eye. And then cover that area with dry sterile dressing, treat it like a burn, and promptly transport. Chemical burns to the eyes can cause extreme pain. They can also cause blindness. So again, flush those eyes with water. We don't use an alkali to balance an acid. We just use water. The solution is dilution to get rid of chemicals. Hold the eye open and have them move that eye around as much as possible so it covers the entire surface. It gets under the eyelids. Flush from the bridge of the nose outwardly, laterally, because if you flush one eye, if you turn the head to one side and you're flushing one eye, and it could actually take that chemical and put it into an uninjured eye. Now they have burns to both eyes. After you flush, cover both eyes with gauze bandages and arrange for transport. Chemical burns to the eyes. Electrical burn. This could be low voltage electricity or high voltage, where electricity enters one point in the body, travels through the body, and then exits the point to get to ground. We're 60% water, and electricity loves water, and it will do anything to get to ground. So if you're at a car wreck, and you see a wire hanging about 10 feet above you and you walk near it, that electricity can actually arc to you to get to ground. Electricity can cause major internal damage. It's kind of like taking frozen hamburger meat and putting it in the microwave, and you can kind of see how it cooks on the outside, but the inside's still frozen. Electricity can do that too. It can cook tissues like the skin and muscles. It can break bones. It can do a lot of different things. It can cause irregularities of cardiac rhythm, and it can result in cardiac arrest and death. So number one, your scene safety. Be certain the patient is still not in contact with electrical power source before you step in to touch or treat them. Make sure the power is cut off. Call 911, call the power company. Hey, check this, make sure the power is cut off. And then start your ABCs of electrical burn patient treatment, assessment and treatment. ABCs. Multi-system trauma. So somebody that has an injury that affects more than one body system. So you're not expected to diagnose a patient's injuries like, oh, this one has increased intracranial pressure from a head injury with a fractured pelvis. That would be a diagnosis, but you can say, this patient appears to have head trauma and has altered mental status. I also notice instability to the pelvic girdle. So that tells you there's two body systems that had significant trauma. We cover head, spine, all the stuff into Chapter 14, so we'll come back and look at multi-system trauma a little bit better later on. Looking at our summary, make sure that you take standard precautions anytime dealing with somebody's body fluids. 3 parts of the circulatory system: the heart, the vessels, and fluid. We think a little bit of the pulmonary system. That's why we talk about cardiopulmonary system a lot. 3 primary causes of shock are pump failure from like a heart attack or cardiac arrest, pipe failure from rapid vasodilation, and then fluid loss, which is going to be the most common. Types of external bleeding: if you see blood oozing out, it's probably from a capillary. If you see the blood at a steady flow but fairly dark, red, dark in color, it's probably from a vein. And if it's bright red and spurting, it's probably from an artery. First thing we'll do is direct pressure with dry, sterile gauze dressing. And a wound is anything that has damage to a body part. So they're classified as closed or open. And open wounds, we talked about abrasions, punctures, lacerations, avulsions, and then amputations. We control bleeding by direct pressure, maybe by elevation, maybe by indirect pressure. And then we say lastly, but just think about how much blood is coming out. And if you take your time trying to do the other steps, they could lose significantly more blood and have more complications, so we would slap a tourniquet on. Proximal to the injury, so between the injury and the heart. 3 classes of burns are superficial, partial thickness, and then full thickness. And burns can be caused by heat, chemicals, or electricity. A little bit of a review. Which of the following statements regarding standard precautions is true? Standard precautions assume that all body fluids are potentially infectious. That's a good rule to follow. Everybody you come in contact with potentially has some kind of infectious blood, infectious airborne transmission, whatever. So I like that one. Standard precautions assume that some body fluids are potentially infectious. Well, all body fluids are. Standard precautions apply to paramedics who perform invasive procedures. No, applies to EMTs too, who take care of patients with breaks in their skin. EMRs are only required to wear gloves to comply with standard precautions. No, you may have to suit up and wear a gown, goggles, mask, everything. So the best answer there was A, assume all body fluids are potentially infectious. Appropriate management of impaled objects in the eye include bandaging only the affected eye. Remember that sympathetic eye movement, they can still move. Rinsing the eyes with saline, I kind of like that. We'll hang on to that one. Bandaging both eyes, like that better. Removing the object to prevent further damage. And it appears that bandaging both eyes was the best answer there. Patients with full thickness burns generally do not complain of pain because blister formation protects the burn. No, blisters hurt too. Nerve endings have been destroyed. That's the best answer. That's what I see as a good answer right now. Deep burns produce a natural painkiller in the patient's system. Nope. And the patient is generally not conscious. Oh, that may be true, but the best answer there is the nerve endings have been destroyed. So this wraps up bleeding, shock, and wounds, different types of wounds.